you've just joined us, welcome back to Public Service Corner. This evening, we are engaging Boni Singu, Dr. Boni Singu, the Associate Dean for the School of Pharmacy at the University of Namibia. How does work-integrated learning, Doctor, at the School of Pharmacy enhance students' real-world skills now compared to the traditional classroom training?
Yeah, thank you very much. First of all, I would like to applaud the University of Namibia for taking the approach of work-integrated learning, which is very, very important, especially for professional degrees like pharmacy, medicine, and so on, which are really practical. So for a very practical degree like pharmacy, it is really, really important for students to have experiential learning, where, yes, you give them the theory, and then you have to expose them to the real world life. So in the first year of pharmacy training, they do preclinical things, getting them ready, informed, and just preparing them, giving them the knowledge and the understanding of how to handle things in the coming years. So by the time they get to the second year, in the second year, we send them out to the rural areas in the district hospitals and clinics for them to actually experience the challenges that the health force and the healthcare centers experience in those places. So the students get to experience the impact of shortage of medication, the impact of shortage of staff, the impact of what it means when a mother who is unemployed has to travel a long distance to come for the medicine and they do not find that medicine there. So the student gets to really practically understand some of these things you can never be able to communicate very well in class. So in the second year, at the end of the second year, they also go and work in community pharmacies, what are also referred to as retail pharmacies, and they get to experience the business side of pharmacy and serving clients in the business space. And then in the third year, we send them out for industrial placement to manufacturing companies within Namibia and outside. There are not so many in Namibia, but mostly we send them outside as well, outside of the country. And then they get to see what is involved in manufacturing and medicine. Yeah, what are the processes? What are the different areas of a manufacturing plant? What is required? What kind of personnel are needed? All these skills our students are able to experience and see. And then they are also sent into the wards in their third year, into the wards to see exactly how to change doses for a patient and so on. So all this work-integrated learning impart to the students experience so that by the time they actually finish their 4-year training, they've experienced the practical side of the degree. Mm-hmm. Yeah.
Doctor, when it comes to equity of access and affordable care, how does the School of Pharmacy's mission reflect the national healthcare needs within our country?
Yeah, so like I said, the School of Pharmacy, our main mission is to ensure we are producing pharmacy graduates of high quality who are able to meet the needs of our country. So it's really, really important. If you look at our constitution, we stand on fairness, equity, and so on. So really what we seek to fulfill at the School of Pharmacy is to increase the number of pharmacists who will then be able to open up access of healthcare to our population out there. So it makes a real big difference if you have a trained pharmacist giving a certain kind of specialized pharmaceutical care to a patient, rather than if you have, let's say, some other person in the health profession, because of a lack of pharmacists, then they have to do that job. They are not well suited, they are not well trained to be able to execute that job. But when you have an appropriately trained personnel, the quality of service, the quality of healthcare, and the improvement is much magnified. So that is what we want to do. We want to make sure we have well-trained pharmacists who will then increase access by, by sheer numbers. If we have more pharmacists in the country, it means they can go to many more places in the country. But also it means that all these other places in the country, every corner of this country, wherever a Namibian is, the kind of healthcare they will receive is of high quality. Yeah.
How might faculty or resource limitations affect the delivery of clinical pharmacy education as well as mentorship in UNAM?
Yeah, thank you very much. People are the most important source of wealth for any country, for any organization, for any family. It's people. And a lack of people will hamper development, progress, and growth. So the lack of well-qualified staff will not help us to achieve our vision of training quality pharmacists in numbers and also imparting appropriate skills. So it is really, really important for us to have enough staff members who are well-trained in the delivery of these educational needs.
Mm-hmm. What are the school's current research priorities and how do they relate to Namibia's health and pharmaceutical needs?
Yeah, thank you very much. So we have 3 departments in the School of Pharmacy. We have the Department of Pharmacy Practice and Policy. The kind of research going on there is mostly medicines utilization research. We want to look at how well medicines are being used, and how can the use of medicines be improved, how can the abuse of medicines be reduced, and so on. And we also have the Department of Pharmaceutical Sciences, and this department really looks at the development of novel pharmaceuticals and also the improvement or value addition of local herbal medication. And that department is really relevant, especially for our country with untapped local medicinal potential. And then the third department we have is the Department of Pharmacology and Therapeutics. And this is more of really giving precision medicine. Every human being deserves to have the right dose and the right medication given to them. So this department really looks at even to the level of genes. Yes, we may not have all the resources now, but that is what we are aiming to get to. When we take this patient who comes to the hospital, we look at their genes, what is the appropriate dose for this particular person? Not what is written on the medicine that was manufactured in another part of the world for their own people with different genes from what we have. But this Namibian person who has come to the hospital and this medicine is what is prescribed for them, what is their genome like? Therefore, what dose should we give them? So that is the Department of Pharmacology and Therapeutics, and we have several studies going on. Some are funded, some are, they don't require a lot of funding. And of course, the public out there, if there are people who are interested to sort of support our research work, we welcome. So those are the kinds of research going on.
Thank you, Doctor. We will be back after the short break. Stay with us.